Everyone, to our webinar about incorporating geography into National Survey of Early Care and Education, or NSECE Analyses, an overview. My name is Brinda Mahishi, and I am a data project manager for the Child and Family Data Archive. And I am joined today by our colleagues from NORC, Rupa Dutta and Lee Fiorio. But before I turn the presentation over to them, I'll briefly introduce you to the Child and Family Data Archive and let you know a bit about the structure of this webinar. This webinar is hosted by the Child and Family Data Archive, or CF Data, which is where you go to access the NSECE Level 1 and public use data. CF Data is supported by a contract from the Office of Planning, Research, and Evaluation, or OPRE, and is housed at ICPSR within the University of Michigan. It is the place to discover, access, and analyze data on young children, their families and communities, and the programs that serve them. Users are able to access over 350 data sets with the ability to analyze select data sets online. You can also search and compare variables and peruse data-related publications. And of course, user support is also available to assist users in finding and obtaining data. I will be going into more detail about the archive later in the webinar. So this is the first of 3 presentations that are part of an NSECE training initiative to help data users learn more about incorporating geography in analyses of the NSECE data. For today's webinar, Rupa and Lee will provide you with an overview of the NSECE, a presentation of what types of analyses with geography are possible, and the importance of understanding and following NSECE reporting guidelines. Following these sections, I will give an overview of the Child and Family Data Archive and the resources we have to support researchers. Importantly, I will share how users can request access to the NSECE Level 1 data through the CF Data website. And then finally, we'll close this webinar with more information on the January workshops and then a question and answer session. So this webinar provides a more general introduction to using geography variables in ECE research. The online workshops scheduled for January will be more hands-on and will be most valuable to participants who familiarize themselves with specified project documentation prior to attending. And we'll be providing more information on that at the time of registration and closer to the date of the workshops. I am now happy to pass the presentation over to the NORC team so they can share information on the NSECE data.
Hello, everyone. My name is Lee Fiorio, and I'm a survey methodologist at NORC. I'm actually a geographer by training, so I'm very excited to be discussing with you all, presenting on geographic analyses that are possible with NSECE data. So I want to start with some background on NSECE. So the NSECE is funded by the Office of Planning, Research, and Evaluation, that's OPRE, in the Administration of Children and Families in the U.S. Department of Health and Human Services. The OPRE team is listed here. Co-federal project officers are Evelise Martinez-Beck and Anne Rivera. We also want to acknowledge Paula Denary and Bonnie McIntosh for their input and feedback on this workshop as we developed it. The project team for NSECE is led by NORC at the University of Chicago. NORC has been in this role since 2007. Partners have included Child Trends, Chapin Hall, and many other independent researchers. So the NSECE is a nationally representative survey that characterizes the use and availability of early care and education in the United States. The NSECE provides information on ECE providers and households with children. So on the provider side, the NSECE provides information on ECE services available to families in settings that are home-based and settings that are center-based. So for home-based, that's children, home-based providers that serve children under age 13, and center-based providers for children ages birth through age 5, not yet in kindergarten. The NSECE also provides information on the characteristics of the workforce providing these early care and education services, and also on households with children under age 13. The survey was conducted in 2012 and 2019, and it is planned to be conducted again in 2024. I should also mention that there was a separate or an additional NSECE data collection, which was a two-wave COVID-19 longitudinal follow-up in 2020 and 2021 of providers and workforce members who participated in 2019. This is not the focus of today's webinar, but I wanted to let everyone know that this additional data collection exists in case you are interested. So starting with the 2012 NSECE. So the data collection for the survey in 2012 provided the first comprehensive picture of the use and availability of ECE in more than 20 years. It provides nationally representative data about early care and education through 4 integrated surveys. These surveys are of 4 key populations, distinct populations that are conceptualized to span the full spectrum of those who use and provide ECE. So there's a survey of center-based providers to children not yet in kindergarten, a survey of home-based providers to children under age 13, a survey of households with children under age 13, and a survey of center-based classroom staff. The NSECE design is very innovative in the ways in which it uses geography to capture the interaction or attempt to measure the interaction between the availability of care and how families use that care. So we'll be going into this in more detail shortly, but the key idea here is the survey sampled a nationally representative set of families and then also conducted surveys of the providers in the nearby communities of those families that were surveyed. So findings from the NSECE have been used to paint a nationally representative picture for early care and education and to inform states' efforts at consumer education. And as we're going to be discussing here, there's lots of other interesting research applications. So the 2019 NSECE design largely replicates the design of the 2012 NSECE. This was intentional, and it allows researchers to measure change between the 2 survey years. So the 2012 and 2019 NSECE were designed to achieve all the same goals. There are some small differences in sampling and questionnaire content between 2012 and 2019, which we'd be happy to discuss in the Q&A or at a later date. Are there any questions, Claudia, at this time?
At this time, we don't have any yet, so we're good to go. Thank you.
Okay, great. So I'm going to pass it over to Rupa at this point.
Hi, everyone. I'm Rupa Dada. I'm the project director here at NORC at the University of Chicago for the NSECE. I'm so happy to be talking to folks about how the NSECE might be useful in your analyses, especially the geographic elements. I'll talk through the sampling design, which Lee has previewed a little bit for you already. This diagram shows some of the important features of the NSECE In particular, we largely have two different sample sources. On the one hand, we have a household sample. On the left here, we selected a nationally representative set of households to learn about either households that had children under the age of 13, whether or not they use any kind of early care and education, or households where there might be a home-based provider living, somebody who cares regularly for children under age 13 who are not their own. We call that segment of the home-based provider universe the unlisted home-based providers. At the same time, we have a provider sample. These come from administrative lists, state and national administrative lists of early care and education providers. And from those lists, we sampled another set of home-based providers, whom we helpfully call listed providers because they appear on lists, as well as sampling center-based providers who also appear on those same lists. And then from those center-based providers who participate in interviews, we select workforce members to represent the center-based workforce. So you have these four surveys: the household survey, the home-based provider survey, which gets two of its oblongs, the center-based provider survey, and then the workforce survey. As Lee has described, these are independent samples, but we coordinate them by drawing sample in very compact areas. So the geographic areas where we sample are the same for all four of the surveys, and that allows for many of the research possibilities that we'll be talking about today. The particular mechanism we use for bringing all of these four surveys into the same locations is called the NSECE provider cluster. Sorry, I'm rushing ahead. To understand what analyses are possible, you really want to be thinking about what elements of geography are integrated into the NSECE sampling design. We begin at the state level. All 50 states and the District of Columbia have sample in the NSECE, and that sample is selected so that if you can conduct an analysis, it will be representative of that population. From the state level, we then moved down to what we call our primary sampling units, which are counties, or in the case of less populated areas, county clusters. There are across the country about 220 counties or county clusters, with at least two in every state. DC gets one. These counties or county clusters are largely the same between 2012 and 2019. Then within those counties, we have yet a smaller level, which is what we call the provider cluster. There are about 750 provider clusters in each year's data. Those provider clusters, typically there would be at least two low-income clusters and one not low-income cluster in each county or county cluster. By low income, we mean that there is a high fraction of the total population that are living below 250% of poverty. The provider clusters were resampled between 2012 and 2019, so it is not possible to do longitudinal analyses with these. So all 50 states and DC are in the data. There are about 220 counties or county clusters with at least two in every state, and then about 750 provider clusters with at least three in every county or county cluster. Now I get to talk about the NSECE provider cluster. So the NSECE provider cluster helped us to solve a particular problem of design, which is that we wanted the NSECE to give nationally representative estimates of these different populations of interest. But at the same time, we know that childcare is fundamentally a very local thing. Families do not want to travel across multiple state lines or hundreds of miles to deposit their children in care every day. And so we wanted to make sure that we could describe households in the context of the providers that were near to them. And that's what the provider cluster allows us to do. I'll go through the construction of the provider cluster, which is the same across the country, although what the provider cluster looks like varies greatly across those 750 different provider clusters. So we begin with what we call anchor tracts. So for a nationally representative sample, we have selected a nationally representative set of census tracts across the country. And these are the source of the household survey and the unlisted home-based survey. They are also the anchors, each of their own provider cluster. So every census tract that is sampled for the household survey has its own provider cluster, which is constructed in the same way. The yellow here is the anchor tract for this hypothetical provider cluster, which is somewhere in Dallas and may or may not be in our data. When we have our anchor cluster, anchor tract, we then draw a blue star, we place a blue star at the population centroid of that tract. So where is the center of the population? And then we draw a 2-mile radius around that population centroid. That's that blue circle, almost circle you see in the map. That 2-mile circle is the same for every single one of our 750 provider clusters. What we then do is draw in every single census tract that in any way overlaps with our blue circle. So these lines that you can see within the gray area are census tract boundaries. And you can see that some census tracts are firmly within the circle and some barely overlap with the circle. But any tract that in any way overlaps with the blue circle and its interior becomes part of the provider cluster. And then we use this entire gray area and its yellow center as the provider cluster from which we sample centers and listed home-based providers. The Census Bureau draws the census tracts. They have on average 1,500 households in them. And so in populous places, census tracts can be quite compact. They can be several city blocks. But in dense and sparsely populated areas, they can be thousands of square miles. And so our provider clusters similarly expand and contract with the local population density. The minimum provider cluster in 2012 was 11 square miles, and the median was 57 square miles. So already you can see there's some difference, and the maximum is quite a bit greater than that. We also use this concept of the provider cluster to attach various characteristics of the community to facilitate some contextual analysis by researchers. And Lee will talk more about what we call community characteristics later in this session. Before I hand it back over to Lee, Claudia, I think there might have been a question.
Yes, I think we actually have two. So one is just to clarify, so what are the programs that are included when we talk about providers? Is that preschool, Head Start?
Yes, so center-based providers are run the range of publicly funded and privately funded programs that serve children 5 and under, not yet in kindergarten, and are not drop-in only, like a gym, childcare. They're not single activity only, like a tutoring program or a music program. And they are not only wraparound care, for example, a before or after school program. So other than that, Head Start, school-based public pre-kindergarten, school-based private pre-kindergarten, Montessori schools, daycare centers, church-based nursery schools, really the full gamut, as long as they are not providing those excluded types of care, and they need to be providing year-round care, school year care, and not only, for example, summer care. Was our second question?
Yeah, the second one was about can the household data be linked to that data of providers that households use?
So that's a great question. I think Lee mentioned we do have a whole workshop coming up that will talk more about how to use the provider cluster. We can link households and providers that are near each other, but we can't generally link households to the providers they report using. As Lee mentioned, these are sample data, so not every provider locally is in our sample. In addition, some households may be using care outside of their provider cluster. So it's possible to link households and providers that are near one another, but not necessarily households that are using the specific providers that households are using. I think that probably segues nicely, Lee, into what you'll be talking about next.
Great. I see there's also a question in the chat that says, is the term provider cluster synonymous with secondary sampling unit in the NSECE?
Thank you. Let me just clarify that. So the secondary sampling unit is that yellow anchor tract. And so, thank you. The provider cluster is not synonymous with the SSU because the SSU is only the yellow part, the central tract, which will not always be yellow, of course, in the world. And it's not always a wedge. It's whatever shape the census tract happens to be. There is a one-to-one relationship between provider clusters and their anchor tracts. But when we say SSU, we only mean that internal anchor tract and not the whole surrounding area. I'll just add that the SSUs, those anchor tracts, are mutually exclusive. The provider clusters, because of the way they are drawn, can overlap. So a provider can be located in multiple provider clusters, but a household can only ever be located in one SSU or anchor tract. Okay, now I think we're back to you, Lee.
All right, sounds good. Okay, so hopefully at this point, you're all very excited about the potential to do different kinds of geographic or geography analyses with NSECE data. And so, hopefully you're asking yourselves what geographic analyses are possible, and clearly the possibilities are manifold. However, we want to structure your thinking a little bit by providing you with 4 questions that we think you should consider as you're sort of brainstorming ideas of what you could do with NSECE data. So understanding the potentials and as well as limitations of these data, as well as the OPRE requirements for using them. So first and foremost, the NSECE data sets allow many geographies to be explored, but not all. So the first question to ask is whether NSECE data for your research project exist. So you might be interested in some municipal level policy, but municipalities or census places are not part of the NSECE survey design. And so the NSECE, for example, does not support municipal or census place level analyses. So second, a question you should ask yourself, are the data adequate for the planned research? So consideration of available sample size, especially when investigating small groups or domains, is essential. NSECE is a sample survey. It uses weighted data. So questions of statistical precision will also come into play. We want to assure that the estimates that you or anyone derives from these data are accurate and unbiased. So it's important to determine whether or not the proposed analysis design will generate accurate estimates. You might be interested, for example, in the ECE cost burden of all 50 states in DC, but for some of the smaller states, there may not be enough sample size to produce standard errors and reliable, precise estimates. And so that's something that you'll have to consider. So third, not all of the geographical variables, in fact, very few are available in the public data, and so many of the data are only available under restricted use. This means that researchers must follow and fulfill requirements, including data use agreements, submission of research plans to NSECE staff, as well as work through a virtual network. And important thing to consider is that this process of getting access to restricted data can take time. So this can affect the timelines of your research. And finally, before publishing research analyses using restricted data, researchers must perform disclosure review and receive NSECE confirmation that disclosure guidelines are met. So what are the levels of geography that NSECE supports? So probably the easiest way to think about this is think through the geography that Rupa discussed, the national level, state level, county clusters, and provider clusters. So first and foremost, the NSECE is designed to produce national estimates of childcare supply and demand. So national, definitely, that's what the survey is designed to do. In addition, it's also designed to provide region level estimates. So there's a breakdown by region. These are the 4 Census Bureau regions: Northeast, South, Midwest, and West. As Rupa also mentioned, the NSECE makes available community characteristics variables. So these are weighted averages of ACS data from census tracts that comprise the provider clusters that are used in sampling. And so what these community characteristics allow researchers to do, or one thing they allow researchers to do, is to perform national level analyses of households and providers based on the communities that they are located in. For example, if you're interested in doing an analysis, a national level analysis of providers located in urban areas and whether they differ along some characteristic with providers in non-urban areas, then, I misspoke before. If you want to do an analysis of rural areas and urban areas, providers located in each, you could conduct a national level analysis of providers in those 2 different types of communities. Another example might be an analysis of households in communities with high poverty density versus households in communities with low or moderate poverty density. So these are national level analyses that you can conduct with the community characteristics variables. You can also conduct analyses at the state level or the county or county clusters. You can also conduct analyses that make use of these provider clusters, which are designed to help contextualize providers that are near other providers, households that reside in similar communities, or the interactions between households and providers. And just to plug it again, we're going to be devoting the second of our 2 forthcoming trainings on working with the provider cluster data. So where do you find these variables? I want to emphasize here that there are 3 levels of data access. The first is public use, and then there are 2 restricted data levels, L1 and L2. L1 are the less disclosive restricted use data, and L2 are the more disclosive restricted use data. So an easy way to think about this is the more specific and localized the geography of the data, the more restricted the data. So public use data, which includes data on region. 2 of the community characteristics variables are available for download from the ICPSR website. But additional community characteristics are available in the L1 restricted use data file, which are available in the Child and Family Data Archive. And the 2019 L1 files are also becoming available there. Any data not available from CF data, whether public use or L1, can be accessed through accessed by researchers through the level 2 restricted use mechanism operated by NORC. So all geographic identifiers, so below region really, are available only through the L2 process. So this includes state, county or county cluster, which are the PSUs, the primary sampling units, and then the provider cluster level data as well. So one of the really exciting things about working with NSECE data is that it allows for the linkage to the one very interesting way to use the geography in particular is to use it to link external or non-NSECE data to NSECE data. So we support linkage at many different levels. For instance, if a researcher wants to link data on state level policies to NSECE data, to research how these policies impact ECE in those states, that's possible. Linkages at the county level are also possible. If you're interested in childcare licensing rules, like education requirements for teaching staff, economic factors like business growth, recent business growth at the county level, COVID, county level COVID policies and so on and so forth, we can facilitate linking those external data to the counties and county clusters in the NSECE data. We even, facilitate address level linkage. For example, if a research group were to provide us with a data file with a newer list of licensed providers, we could match that on the address of the providers in our sample to see whether they're still providing care. Things like this can also be facilitated. An important thing to note at this point is that due to disclosure reasons, the NSECE team must perform some of these linkage. So the researcher team will provide us with data they want merged on or linked, and the NSECE team will link it, maybe aggregate it to those community level, depending on what the data are, so on and so forth. But linkage is definitely something that a researcher should take advantage of. And we're going to cover this linkage in the first workshop that we're doing in January, on January 24th. So at this point, hopefully everyone's, whistle has been wet in terms of the kinds of research questions that could be asked with the data, but I want to run through some hypothetical research questions here. So the first one, how many 2-year-olds received center-based care in the Northeast region as compared to the South region? So this is an example of a research question that could be answered using public use data, either nationally, or in this case, I'm sorry, regionally. A second question might be, do characteristics of center-based or home-based providers differ by community poverty density? So this would be a national level analysis that'd be making use of the community characteristics variables that I described earlier. So a third question would be to also, third question is an example of a question that also uses the community characteristics, but one of the L1 level community characteristics. So the question is, do qualifications and demographic characteristics of the ECE workforce differ by the characteristics of the communities where they work? For example, by the racial or ethnic composition of these communities? So that you'd be using the community characteristics that describe the racial or ethnic composition of the provider clusters, and then combining that with the workforce data to analyze whether the workforce the qualifications or whatever you're interested in about workforce differs by whoops. Differs by where the providers are found. So let's see, hold on. I don't know how that happened. Okay. A fourth question is, in what states did the average 2019 household ECE cost burden exceed 7%? And a final question might be, do states with universal state pre-kindergarten have higher rates of enrollment in center-based care among 4-year-olds? So both of these would be state level analyses. The second of these, the last one on this list, would be one that would involve linking at the state level external data on states with universal pre-K, for example. So are there any questions at this point before I move on to the next section? It looks like there are some.
Yes,
in the
there are
chat.
three.
Yeah.
So the first is, can you explain a little bit about why research plans are needed for restricted data requests?
So I might suggest that we wait until we get to the disclosure section and we can talk about research plans and information about sample sizes and things, which is coming up in a few slides.
Okay. Our other question is about, are the 3 county clusters in each state representative of that state?
Rupa, do you want to answer this question?
So the answer is that they are selected randomly, which would be the process that one would use to generate representative estimates. So if a statistician were here present, which I am not, I believe the answer is they are selected in a way that should generate unbiased estimates for that state. Of course, depending on your research question and the granularity that you need, you may find the sample sizes adequate or not to address a particular question, but they are selected in a way that should generate unbiased estimates for that population. Lee, are you enough of a statistician to endorse or not that answer?
That's what I would say. Yes.
And then our other question is, can one find out how many and what counties or county clusters are available for a state as preliminary to inform decisions for further inquiry?
So it is possible there is a level 2 process that maybe we can put the link in the chat during which researchers ask some questions to determine what will be feasible. There are some materials from the design phase that give some indications of the numbers of PSUs per state. The actual counties or county clusters, we would only disclose if it were necessary for the analysis and not outside of the level 2 environment. But the basic answer is that certainly we welcome researchers to inquire with the NSECE team. The email address, maybe we can also put in the chat, nsec@nrc.org. We answer a lot of questions about sample adequacy for researchers, depending on the analyses they're contemplating.
I'm going to add one more question to the mix before we move on. It's about community characteristics. I just want to clarify, are those based on ACS variables, or are there any other sources used for those community characteristics?
So most of them are based on ACS variables. Obviously, the 2012 community characteristics and the 2019 community characteristics draw on different vintages of the ACS. For the urbanicity variables, that's from the decennial census in 2010 to measure urbanicity. I think those are the only 2 sources for the community characteristics variables. So the ACS, to answer your question, the ACS is the main one.
We have worked with some researchers on individual projects where they had other census tract level data that we were able to build community characteristics out of for their research requests. So if a user wanted to build a community characteristic using that cluster definition, we can work with them to do that, but all of the ones that are currently on the data files, as Lee says, are either from ACS data or from the descent process.
Great. So the next segment of the webinar will be on comparisons over time. So because OPRE funded NSECE in 2012 and funded it again in 2019, the two sets of data afford researchers to opportunities to compare geographic data in the two survey years. Last year, there was a training session on making comparisons that included a section on comparing NSECE data over time. So you'll see on this slide, lots of different kinds of comparisons that can be done: national estimates, national subgroups, nationally defined community types, states or groups of states can be compared across time. So OPRE has released various analytic products that illustrate over time comparisons of the two vintages of data at the national level that researchers may want to consult if they're interested in conducting this kind of analysis. But there are lots of questions that can be asked. For example, just to throw one out there, how did the number or characteristics of home-based providers differ in 2012 and 2019 for communities of different urbanicities? Or do we see greater increases in ECE participation in states that expanded public funding for ECE between 2012 and 2019? As Rupa mentioned when describing the sample design, the SSUs, so that example, little yellow wedge, that anchor tracks, and the clusters around those tracks were sampled independently each round. And so those cannot be compared longitudinally because we sampled different ones. But otherwise, all 50 states and DC are in both years. The set of PSUs, which are the counties or county clusters, are in both years of data for the most part. So yes, there's lots of comparisons that can be done at various geographic levels over time. Although that they followed similar designs, the 2012 survey and the 2019 survey, respondents differ in each year. And so for this reason, most analyses will be cross-sectional, comparing aggregated results across the 2 years. And in many ways, this is a good thing. You wouldn't want to be interviewing. I'm not touching anything, so let's see. Where were we? Not reporting guidelines. Okay. So the analyses might I was going to say, so you the data are cross-sectional, and that's probably what you want in many cases. Like if you're surveying a household with a 2-year-old in 2012, that 2-year-old is going to be 9 in 2019. And so if you're interested in center-based providers who serve children birth to age 5, not in kindergarten, well, then a longitudinal analysis wouldn't really be appropriate in that case. But longitudinal analyses are possible at different geographic levels. So you could study changes to states over time, even changes to the PSUs, which are the counties or county clusters over time. This is a restricted data example, and it would require working with NSECE staff. And then lastly, just to plug it one last time, there were these COVID-19 longitudinal follow-up surveys in 2020 and 2021, which were longitudinal analyses of providers and workforce in 2019, 2020, and 2021, and those would allow for longitudinal type analysis. So at this point, I'm about to hand it over to Rupa, but I want to ask again, are there more any questions on the comparisons over time aspect of the data?
I don't think we've introduced Claudia. Claudia,
Oh.
would you like to introduce yourself?
Sure. I'm Claudia Zapata-Guido. I'm a research scientist at NORC, and I've been working on the NSECE analysis side of things, and have been with the NSECE since we started data collection for 2019. So there's that. We have some questions kind of going back a little bit to, we've been talking about state level estimates, but what state level estimates are possible with the NSECE data?
Do you want to answer that, Lee, or do you want me to?
So I guess it would be, so the state level identifiers are available under the L2 restricted data guidelines, but any analyses of NSECE data from any of the 4 surveys is possible at the state level, but there would be considerations that a research team should have about whether there's enough sample size in each of the states, and then whether in reporting the data, whether they meet the disclosure guidelines. So I think, to answer your question, Rupa, correct me if I'm wrong, really anything is possible at the state level with the data, and outside data can be linked at the state level as well. So yeah, would you add anything to that?
The only thing I'd add, Lee, you're exactly right, is that unfortunately the laws of sample surveys follow closely with the size of the population. So states that are already populous, like California and New York and Texas, also have a lot of sample in the NSECE, and states that have relatively less population, Wyoming or Vermont, have fewer sample in the NSECE data. As a result, almost anything you want to do in California and Texas is probably feasible, but as you go down the list in terms of the population size, that roughly corresponds to the sample size that would be available. And so depending on the small subgroups you're interested in, the types of locations you're interested in, there can be quite a broad range for simple state level, kind of population level estimates. Many things are reportable for 35, 40 states. For detailed analyses of subgroups, you can quickly find yourself so that only 3, 5, 8 states can support that level of state level analysis. It really depends very much on the research question, and we often advise people to use the public use data to see how quickly your sample sizes fall. If you're looking at centers that serve infants and toddlers and are open overnight and receive public funding, you'll see that the original 6,900 centers quickly became a handful. And so you'll know that you probably can't do that at the state level. So that's some general guidance. Are
And
we
that's probably a good segue for you guys. There's some other questions, but they'll fit better under that.
So I'll talk a little bit about reporting guidelines. One thing we want to emphasize is OPRE is extremely committed to researchers being able to use as much of the data to answer important childcare related questions as possible. And so we, the NARC team, work very closely with researchers to figure out how we can respect the necessary disclosure guidelines, but also let researchers do their work and present their findings. What that means is sometimes we have to be creative and rework things a little bit so that it'll work, but we want people to both understand that the requirements are quite strict, but that we're very much committed to being to working with researchers to let you do the work that is possible with the NSECE. Let me start in on how that works. So why do we even clear? Why are we talking about disclosure risk? The NSECE collects a huge amount of data, and like any good, responsible research effort, we want to be ethical and respectful. We have IRBs, we actually have a certificate of confidentiality. NSECE and OPRE are very much committed to protecting the identity and data of all of our respondents. This includes not just evil intruders who are trying to wreak havoc, but also well-intentioned people who may inadvertently use the data in ways that reveal that increase disclosure risk for other researchers. We also have to remember that childcare is a business for a lot of organizations, and respondents who are in the survey may be competitors of other respondents who are in the surveys, and we want to make sure that that kind of disclosure is also not possible. Ultimately, we're all interested in maintaining respondent trust for good future research, and the NSECE wants to do our part in that. Disclosure risk across the NSECE files varies very widely. It's really the center-based providers that are at greatest risk of disclosure. Well, why is that? Well, we start by having publicly available administrative lists, which is where we sampled them from to begin with. There are about 120,000 centers, and 7,000 of them participated in the 2019 NSECE. So it's actually quite a high sampling rate. In addition, think about centers, right? They have websites, they tell you their hours and their location, and their rates and their size. There are licensing lists. There is so much publicly available information that linked to the NSECE responses, it would be quite easy to identify individual center-based providers. And so protecting their identities is the primary focus and motivation for the rest of our strategies. Admittedly, the households and home-based providers, the workforce members have significantly lower risk of disclosure. However, we have adopted a set of disclosure requirements that pertain to the entire study, and ensuring in particular that no one researcher does anything that would preclude other researchers from doing work in the future. So the reporting guidelines are very much about helping analysts report their analyses in ways that protect the identities of the respondents and don't forestall other research from happening in the future. So the first thing that happens to protect against disclosure risk is that the NSECE team gives a lot of thought to how we put out the public use data. And what we determined was that geography was the greatest threat to disclosure risk. Once you know where a center might be located, the narrower that area is, the more likely that the center would have a unique set of characteristics within the survey data that would make them identifiable. As much as we can keep that geographic definition, broad, we can provide a lot more data about each center. So the public use data actually have very detailed information about enrollment and prices and hours and staffing compensation. However, the way we're able to do that is that the public use files are national. The only geographic identifier is region. So it only cuts the country in 4. We do that. An alternative would have been to provide less information about enrollment and prices and those kinds of things, but maybe provide more geographic information. Our general strategy is to limit the availability of geographic identifiers so that we can provide as much other detail as possible. So distances are in some cases in categorical form in data files, but often continuous measures are in restricted use data. Geographic identifiers are only in restricted use data. Lee's already mentioned a couple of times where we use categorical variables to provide information in public use files. And then if you want the more refined continuous measures, then you need to move to restricted use data to do that. So these are different ways that the NSECE team manages disclosure risk in the data files that we put out to the public, particularly the public use data files. Then we also ask researchers who have access to restricted use data to implement precautions in how they share their work with the same intent. Our general approach is to try to provide as much as possible to researchers to ensure that they can do their work, but then be quite strict about how analyses can be shared and presented in public settings. The 3 main techniques we use are suppression of cells. So you can't report an estimate that only has 7 cases in it. You generally wouldn't want to anyway, because those are highly unreliable estimates with big standard errors. We also have guidelines for rounding of estimates and restrictions on the number of significant digits that can be displayed. Because the disclosure risk varies, the thresholds also vary. So again, center-based providers are the most at risk. So their minimum cell sizes are the highest. Households, workforce members are at lower risk. So the minimum cell size there is much lower. And there are level 1 and level 2 versions of those thresholds that you would find as you investigated the restricted use access. Claudia, I think there were 2 questions about level 2 data that you asked that I tabled, and if you could remind me what they were.
That's right. One of them was about, can you explain why research plans are needed for restricted data requests?
Yeah, so that's a great question. As I mentioned, we want to be very flexible. We want people to be able to do this work, and we want them to be able to report their work after they've done it. Research plans let us do 3 things. First, we are able to confirm, and OPRE approves all of the level 2 research plans. The first thing is to make sure that this is a legitimate research effort. Somebody is not using the NSECE to do nefarious things. Let's assume that's rarely the case. The next thing it allows us to do is to provide only the data that are necessary for analysis. So that's another way we limit risk, is by only providing the data that researchers need for a particular analysis, and the analysis plan facilitates that. But the most important reason probably is that we know that these reporting guidelines can constrain what is reported. So, for example, the rounding, the suppression, the cell sizes. In addition, we don't allow any cell to be reported if the underlying population doesn't have at least 3 either counties or states contributing to the estimate. Which would mean that you might have a design, oh, I want to report state level estimates of universal pre-K by rural and urban. Well, we want to make sure that you can actually report everything you're planning so that you don't come to us 3 weeks before your dissertation is due and find out that none of it will match the disclosure thresholds and we won't let it out of the level 2 environment. That would be very sad. We don't want that to happen. So we work with researchers as early as possible to make sure that their plans for presenting the data will be feasible, and that if they need to make any adjustments to their analytics strategies, they're able to do so along the way rather than finding out at the end. Simple things like crosstabs are more disclosive, regression coefficients are less disclosive. Individual states, of course, more disclosive. If you pool states, or better yet, if you are able to create categories of states and don't have to name them. So there would be like high supply states, low supply states, restrictive states, liberal states, like those kinds of things allow more cover and reduce disclosure risk. And the research plans allow us to do a lot of that disclosure related work along the way so that the whole process is smoother for researchers and you get your analysis and results sooner and less stressfully. Question, then I'll go.
Yeah, a related question then, is there a cost to working with NORC and the NSECE team for specific research requests?
So OPRE funds the access of all of these data, level 2, level 1, and public use. There are situations in which a researcher might request something that would not be of general use to the research community. If it's a very specific request, it is possible that there could be a cost for data production or some other kind of support, but the vast majority of level 2 researchers, and I think all level 1 and public use research are doing everything at no cost for the data access.
Okay. And then a follow-up question from a previous question that was asked in the chat, which was about being able to work remotely with these data in a virtual environment. The follow-up question was, are you able to save any of the variables that you've been given access to via the virtual environment onto your own laptop to work on offline?
I'll answer for level 2, and I don't know, maybe Brenda, you would want to answer for the level 1 data available from CF data. So the level 2 are the most restricted use data. All of that work is done via remote access to a secure server. Nothing can be removed from that environment until it has been blessed for public access. So there are really only 2 levels. You're in the environment, you're using the restricted use data, or you can take it out, in which case you're free to put it on the front page of USA Today or your favorite billboard, and we're fine with that. And there's really no middle ground, but the web access can be done from wherever. So it's quite flexible in that way. That's the level 2 setting. Brenda, maybe you would want to discuss the level 1, which is a little bit less restrictive.
Sure. I'll be going over this a little bit more in my slides, but for level 1 data, we do have different levels where we have something similar to what Rupa described with a virtual desktop environment, but we also have the option of a secure download for those who qualify, and there is a specific data security plan that you would have to have approved, so you'd have to work with us, and we don't allow raw data to be shared or kind of saved on an unauthorized computer.
Great. I'm gonna keep going and we have more to do. So in summary, what we Lee's kind of started here, and we want to bring it back to the same thoughts. We really want you to use geographic aspects of the NSECE in your work. As you're thinking about that work and the potential analyses you could conduct, it's useful, I think, to think of this NSECE sample design as fixed. It is what it is. Places are in the sample or they're not. We have these state, county, provider cluster levels. Those are the levels at which unbiased estimates can be generated. There's not anything really as a researcher you can do about those elements. However, the data themselves have a lot of flexibility in them. There are various units of analyses. You can also link any number of things at any number of levels into those data. So as a researcher, there's a huge amount of creativity and flexibility that you can bring in these middle, like analysis of the data, linkage to the data. And then when it comes to what you can actually report, there are some fixed requirements. We will never let you do an analysis of, the city of Houston because it's not supported in the data and it's not a reportable unit. It wouldn't meet our disclosure requirements. However, in 7 years of restricted access, I don't believe we've ever had a researcher who had enough sample size where we couldn't figure out a way for them to be able to report their analyses within the disclosure guidelines. Sometimes it takes some tweaking, but we can be flexible about how you can get to analytic results that you will be able to report. And so as you're thinking about potential analyses, we encourage you to sort of parse them on those different dimensions. We have these various resources. The most important one, I think, is this email address, nsec@norc.org. We strongly encourage people to write in with questions. Why is this variable this way? How do I use the weights? How many cases are there in Oklahoma? Whatever it is you want to know, write us. And these other resources will be available in the deck. As we've mentioned in different places, we have 2 upcoming workshops that'll be much more interactive, and we will be sending out registration materials shortly for those. Okay, I think we're turning it over.
Okay, thank you, Rupa. So as Rupa has mentioned earlier, level 1 and public use data are available through CF data, while level 2 is available through NORC. So I'll be giving you a brief overview of CF data and how to access the data that are available here. As I mentioned before, the Child and Family Data Archive, also known as CF Data, is an archive that is funded through an OPRE contract and hosted by ICPSR at the University of Michigan. Launched in 2019, CF Data preserves and disseminates data on topics related to young children, their families and communities, and the programs that serve them. So NSECE is one of hundreds of data sets archived at CF Data with accompanying documentation for secondary data analysis on important issues of policy and practice relevance. These data are available to researchers to analyze free of charge. So we have a range of data, including on federal and state-funded programs such as Head Start, the Child Care and Development Fund Block Grant, and the Maternal, Infant, and Early Childhood Home Visiting Program. We also have administrative data, community-based surveys focused on parent and child development, and observational studies in classrooms and homes. The CF Data website is available at childandfamilydataarchive.org. Through the website, researchers, policymakers, and other users can explore data, learn more about childcare and early education research, and discover the training opportunities presented by CF Data. Under the Data tab, users can search and browse the over 350 data studies cataloged at CF Data, and you can also browse our most recent releases under the newly released and updated data link. Other data-related tabs include the variables and publications tabs. So these tabs allow users to search for variables and data-related publications of interest and then link back to the study's dataset. Under the About Us tab, users can learn more about CF Data, our project team, and announcements, data releases, and upcoming trainings through the news link. We also have a collection of video resources on our website under the Support for Researchers tab. So here you will find many videos of data release webinars and their accompanying slides, as well as data trainings offered by data producers, including several past trainings about NSECE. You can filter the videos by a particular data set here, and a video recording of today's webinar, along with the slides, will be added to this page when it is available. So this was just a brief overview of CF Data, but to learn more about the archive, we encourage you to visit us at our website and click on the About Us page. And here you'll find a fun short 2-minute video that introduces you to the collection and the resources we provide to users. So now let's turn to how you can access the NSECE data. Before accessing the data, we encourage new users to first assess whether the data are relevant for their needs. So under the Support for Researchers tab on the CF Data website, users can review the data training resources from the NSECE page. This first tab on this page gives a great overview of the study, including a video on getting to know the 2019 NSECE. On that same page, if you go to the Data tab, this is a quick way to download the quick tabulation manuals and the user's guides to help you get familiar with the data sets available. And then once you have decided what files you will need for your analysis, you can click on the link to the 2019 or 2012 study homepages as circled here. So for the NSECE 2019, there are 2 study homepages. One is for the public use data, and one is for the newly released level 1 restricted use data. And this is a screenshot of the 2019 public use data study homepage, but the structure of both pages are the same. The homepage is where you will find important information, such as a summary about the study and information on the study's methodology, weights, and more. The study homepage is also where users can search and compare variables and view publications based on use of the NSECE 2019 data. For public use files, users can download the data in the format of their choice from this list, which includes Stata, R, SPSS, SAS, and others. So after you create an ICPSR My Data account and login, users can download the data directly to their computers instantly. Another feature on the study homepage is the variables search tab, where users can search for and compare variables within the NSECE 2019 data. You simply enter words or phrases that relate to your measures of interest in the search box, highlighted here. And then the search results will return a list of variables related to your search term, including information on the variable name, the label and question text if it's available, the variable type, and the associated data set by data set number. So the variable level search feature is another great way to identify variables of interest, in addition to exploring the study code book, users guides, and other documentation. So here we have the 2012 NSECE study homepage, which has both public use files and restricted use files available on the same page. Users can tell if a file is a quick tabulation, public use data file, or restricted use data file from the file name, as shown here. Similar to the 2019 study, the public use data files can be downloaded directly from the website. Documentation for the restricted use files can be previewed here and also downloaded directly on this part of the study homepage under data and documentation. However, to access the restricted data, a restricted use data application is required. So here you can see to access the level 1 data for either NSECE 2012 or 2019, you will click on the Access Restricted Data button that's circled here on the study homepage. When you click on that button, this modal box will open up with more guidelines for applying for the data. The restricted use data files can be accessed in one of two ways. The first method is through what we call secure dissemination, where a user will download the data directly to either an external hard drive, a non-networked computer, or a virtual enclave on an isolated network, as indicated in their approved data security plan. The second method is through ICPSR's Virtual Data Enclave, or VDE, where users will access the data via ICPSR's remote desktop. Applicants with a terminal degree, such as a PhD or MD, etc., in a social science field and an appointment at a research institution are likely to be approved to access the data via secure dissemination if they choose, while other users will need to use the VDE method. Once you click on the method you will be using to access the data, shown here, you will be directed to the application portal for your method of choice. So this is a screenshot of the application portal for the secure dissemination method, but the information required for access is the same for both methods. The application requires several pieces of information. Access to restricted data at CF Data requires the principal investigator to hold a terminal degree. However, students or other researchers can still access the data by having a sponsor with a terminal degree, and then you would be listed here under research staff. Other required information includes a description of the intended research project, a data security plan, an IRB letter, and a restricted data use agreement acknowledged by the principal investigator and signed by a representative from your institution. The approved application is then valid for 2 years from the date of the institution signature, and then you can extend annually after that. Archive staff are available to assist you with your application and to answer any questions that come up. So just email us at cfdata-help@umich.edu with the application request number. And then here, I just wanted to put up another reminder about the upcoming interactive workshops on January 24th and 25th, 2023. Participants can register for one or both workshops, and you'll find more of the more registration information coming up in the next week or so. And you can also subscribe to our listserv on the Child and Family Data Archive.org website, and you'll stay up to date on the registration information. And now we are happy to take some more questions. So please feel free to type it into the Q&A, or if you'd like to ask your question out loud, you can raise your hand and we will allow you to unmute. Claudia, are there any questions that you would like to?
I wanted to see if anyone was going to brave the asking out loud. I was hoping someone would. Okay. I don't see any other questions otherwise in the chat or in the question and answer. So I do have a question. This question is, can I analyze information about school districts?
So that's a great example where in general, the school district is not a geographic level in our sample design, and therefore we would not expect to be able to generate representative estimates about school districts. There are some exceptions where the school district is at the county level. However, what we would encourage people to do, depending on the research question, is it is certainly possible to attach school district characteristics to individual cases, households, providers, or to SSUs, provider clusters, counties, whatever level you would like, so that, for example, presence of pre-K within the school district or third grade reading scores or whatever it is you wanted to attach, you could use this mechanism of linking external non-NSECE data into the NSECE. And so people have linked school district data to our samples for analytic purposes, but it's unlikely that you could actually do analyses about or at the school district level.
Similarly, finer and finer grained here. Can I use individual providers' addresses in my analysis or in my analyses?
Lee, do you want to answer? Do you want me to answer?
You can answer.
So the provider address, for sure, we can facilitate the use of the address in researchers' analyses. That is direct identifying information. So that is not information that we would give to the researcher. However, presumably you are interested in the address for some purpose. You want to link to a data set, you want to calculate the nearest bus stop, you want to know what the air pollution is there. And so whatever that information is, or however that address would be used analytically, the NORC team could help the researcher implement the creation of a variable or creation of an analytic approach to make use of the address, but the address itself would never be available to the researcher.
And then this question that I don't know that we talked a little bit about this, but I don't think that we actually addressed this one, which is how long does it take to get access to restricted use data?
Brenda, do you want to?
Sure. Yeah, sure. So for restricted use data at ICPSR, we can provide an initial review of your application within 2 weeks of submission. And then we can work with you to make sure that all parts of the application are in compliance. And once you are approved, you will receive the data within 2 days, 2 to 4 days. But we do recommend that you start the process of the application 2 to 3 months in advance, because it does take some time to gather the materials for the application, such as the institution signature and the IRB determination letter.
It's very similar for level 2. There are some steps that are often out of the researcher's control, like the institutional signature, the signing of a data use agreement, that can be relatively quick or can take some extended period of time. Once a feasible application has been submitted, OPRE will review it, and the data can be available within a couple of weeks. We find that people who are repeat users of the level 2 process can in fact get data from application to hands on the virtual data within a few weeks, but for other researchers, especially first-time users, it can take several weeks, if not 2 to 3 months, to get all of the paperwork in order and to get a feasible application put together. So we encourage people to be in touch as soon as you have an inkling that you might want to use the data. And similarly on the extraction end, NORC does confirm that all the disclosure guidelines are being met. And so if everyone is able to do that perfectly the first time, extraction can happen in several days, but we find on average, it takes a few weeks for people to make sure that all of the guidelines have been met to get their data files out, to get their output out.
Okay, and I think maybe our last question is about will the recording of the webinar be posted, but is there a time frame? Do we know when someone might be able to look back at this?
Sure. Yes, we think the webinar will be posted within 2 weeks. We just have to get it closed captioned and get all of the slides compliant. And then once it is ready, we will send an email to all of the registrants of the webinar today to let you know when it's up.
So Brenda, I thought you were going to say thank you for attending and send everyone up.
Yes, it is 2:30. So yes, I do want to thank everyone for attending today. And I want to thank Rupa and Lee for sharing this information. And again, I encourage you to sign up for our listserv on the childandfamilydataarchive.org so that you can get more information about the upcoming workshops in January. Thank you, everyone.
Thank you.
Thank you.
Thanks, everyone.